Hello, everyone. Thank you for joining our second subject matter webinar of our first day of the week of webinars from the Kentucky Regional Extension Center. We're really glad you can join us for our first ever virtual webinar series. Sorry about that. We're first ever webinar series in place of our usual in-person events. So we really appreciate you following us onto the internet so that we can provide you this information that we love to share with you in person, but in a safe manner due to the national emergency. This afternoon, we are going to be presenting on HIPAA, How Well Do You Know Your Business Associates? Today's presenters are Seth Taylor and Amy Daly, who are both quality improvement advisors with the Kentucky Regional Extension Center. A couple of housekeeping items first. Please keep your lines muted, and if you have any questions, please put them in the group chat. We will most likely not have time to answer questions during this session, but we will be recording every single one of your questions, and our advisors, Seth and Amy, will be getting back to every person to answer those questions. Next slide, please. Please read our disclaimer. It's provided to you every time from our attorneys. Next slide, please. So Seth and Amy are both HIT advisors with the Kentucky Regional Extension Center, along with our managing director, Brent McCune. He is part of the HIPAA privacy and security team. Seth has over 15 years of information technology experience, and he's been with the REC for almost 3 years, supporting data coordination and the HIPAA privacy and security service line. Amy has a background in computer information systems and has worked in healthcare for 10 years. She's been with the Kentucky REC for 5.5 years, supporting our promoting interoperability and HIPAA service lines, and is certified in healthcare, privacy, and security. Next slide, please, and take it away, Seth.
Thanks, Catherine. So I just want to, again, thank everyone for taking the time to be with us today. And, you know, we were looking at, when we were approached about this webinar, what kind of content was going to be great for our clients and just individuals that are looking to protect their organizations. And our whole team, we have performed security risk analysis or assessments all over the state of Kentucky, even some states outside of Kentucky. But we've done small one-doc shops and all the way up to hospitals with, 20 clinics. So we found that there was a trend of business associates and lots of questions surrounding those and what they need to be including and how they need to be tracking those business associates. And so we decided today to just take a look at all of those aspects of business associates, including agreements and all that, just to cover and give you the knowledge of what you should be doing as an organization. We're going to be looking at, all the rules that apply to covered entities and business associates. So looking at the Omnibus Rule of 2013, that really put just a large refining definition on what business associates need to be doing with protecting information. So Amy's going to get into a lot of detail on that. And then we're going to talk about what exactly is a covered entity and what is a business associate. Some people there's some confusion there of what the difference is. So we're going to look at those items and then we're going to see exactly, what is not considered a business associate and just kind of define some differences there. We also want to we have a lot of questions about business associate agreements, as I said. So we're going to give some exact examples of, what OCR, or the Office of Civil Rights, and the Health and Human Services is looking for in a business associate agreement. And if those, if there is a breach of some sort, you know, what those breaches look like and what you just need to be tracking for all of those business associates. Next slide. So as I said, the Office of Civil Rights and Health and Human Services defines business associates as vendors to a covered entity that create, receive, maintain, or transmit protected health information. So what does that mean? Like the HIPAA privacy rule allows covered entities to let business associates perform aspects of their jobs that they might not necessarily be able to do because, you know, some of you are large organizations and you just can't do everything. So you have to have someone else do that information. So the privacy rule says that you are allowed to do that as long as that business associate is protecting your information just as well as you would as a covered entity. The security rule also goes into that aspect that says, you know, you have to electronically, you need to ensure that your business associates are protecting the confidentiality and integrity of all of that electronic protected health information, excuse me, and in all the ways that that is created, received, maintained, or transmitted. So those four words are like the definition that really makes it where, are they a business associate or are they just a contractor? And we'll get into that a little bit more a little bit later. One of the key aspects of an organization is to have an enterprise-wide security risk assessment. So as the HIPAA privacy and security rules, the security rule talks about conducting an accurate and thorough risk analysis or assessment. So this lets you take a look at your your vulnerabilities, and this is required for not only covered entities but business associates too. So this, if you have a breach per se, and OCR comes into your organization, the first question that they're going to ask you is, when was your last security risk assessment done, and where is that information? So this is just something that has to be done, and they are going to look at the definition of the scope of use. So making sure that you're identifying all of the systems that create, receive, and maintain that EPHI. And that during a risk assessment, you're going to identify any threats or vulnerabilities to your systems, and that could potentially breach that information or could just get out. You're also going to be assessing any current or lacking security measures that are in place. So we're looking for, you know, physical, administrative, and technical safeguards, and a risk analysis is going to identify those aspects for you or for a covered entity, and or for a covered entity or business associate. And then upon that, if you do have a vulnerability, what is the impact and likelihood of those aspects to your organization? If something were to happen and something got out, what impact is that going to have on your organization? And then that's going to lead to a risk rating. So you're going to see a high, medium, or low risk of that impact and likelihood.
All right, well, thanks, Seth, for bringing us up to speed about privacy and security and how it relates to the business associates. And so we're going to get into more about specifically business associates and what they mean to your organization. But before we do that, we're going to talk about the way that we're going to get into all of that is we're going to talk about the HIPAA Omnibus Rule. But before I do start going into the changes that were brought about with that Omnibus Rule, I thought we'd have a little bit of fun. This is the part where we want everybody to interact and have some fun. So because, well, let's face it, I mean, HIPAA content is kind of dry in nature anyway. So let's take a break right here at the beginning. Let's do some fun. I think some of you logged in earlier to our How to Log On session, and some of you got to experience the annotate feature of Zoom. So what I want to do is I want to ask you, how familiar are you with the HIPAA Omnibus Rule as it relates to business associates? There were a lot of changes that were brought about in this rule. So if you know how to annotate, and the directions are here, click the view options, drop down at the top of your screen, choose annotate, choose a stamp, a heart. I see some coming in already, check marks, and yeah, you can draw, you can make use your own little drawing. And somewhere on this spectrum, just give me a stamp, and it's completely anonymous. So it's not putting your name on there. You don't have to feel any shame if you aren't familiar. Listen, there was a time not too long ago that I thought I knew more than I did, actually, when it relates to the Omnibus Rule. So this kind of helps me gauge where we kind of stand as a team today on business associate knowledge relating back to that Omnibus Rule. I love the big X and the big circles. It's like, I need a little more help here. Okay, just another few seconds just to give you all a chance to find your annotation features, and then choose any stamp or any drawing tool. Sorta, kinda, that's kind of where I figured most of us would be falling in today, is the sorta, kinda range. It's like, oh, I've heard of it, but maybe I need to polish up a little bit about business associates, and that's why we're doing this presentation today. All right, well, this is fun. I love seeing all of the decorations. All right, well, let's just go ahead and jump into it then. So we have a lot to learn. Thank you for participating in this, by the way. On the next slide, there we go. And we'll want to clear, we probably should clear our annotations off so that we can see all, there we go. All right, thank you, Brent Doom. All right, so the HIPAA Omnibus Rule. So let's encapsulate a little bit. Seth said that the privacy rule brought about, the privacy rule had been around since 1996, and it did bring about the establishment of those relationships between covered entities and business associates. The security rule comes around in 2005 and gives us some more guidance on how to handle the electronic form of our EPHI and the safeguards that we need to put in place. The high-tech, when you've heard us at the REC talk about the high-tech rule of 2009, so it came out and it starts to address the use of electronic health records. And there's some language in there about business associates as well. But it wasn't until the HIPAA Omnibus Rule, which came out in 2013, that OCR and HHS started to really get more stringent around our relationships with our business associates. So what that Omnibus Rule did regarding business associates, because there are some components of the Omnibus Rule that don't relate to business associates, but so much of it does. So the Omnibus Rule brought about the most significant changes to the HIPAA privacy and security rules since their inception. So 4 main things that it does with regard to business associates. First of all, it strengthens the ability of OCR to enforce the HIPAA privacy rules and security rules upon business associates, and the ability to levy fines against business associates. So business associates are now liable, which it also clarifies which requirements and liabilities pertain to business associates. And a big thing that it did was it expanded the definition of a business associate. So now, since the Omnibus Rule, a business associate definition will include patient safety organizations, e-prescribing gateways, health information exchanges, and personal health records that are engaged or supplied by physicians for their patients. So that's the main terminology about a personal health record, is if it's something you're supplying for your patients for use, then business associate agreements are required. And then something else the Omnibus Rule did was it brings about the talk of subcontractors. So your business associates can have subcontractors performing acts on their behalf that relate back to your EPHI. And so guess what? They're required to have a business associate agreement between the two vendors, okay? So that's a big change. Let's look at the next slide. What we're going to do is we're going to kind of define out a little bit more and give examples of each of these parties. So covered entity, for example. A covered entity, by definition, is an organization that provides services or products used to provide medical treatment and collect health information about individuals or groups of individuals. Also, a covered entity is defined as any medical provider, large or small. So we get a lot of questions, I'm just a small one doctor office. If you electronically transmit personally identifying health information, then you are considered a covered entity. So OCR breaks down covered entities into three main categories. There are providers, there are health plans, there are healthcare clearinghouses. And the disclosure of protected health information, PHI, from one covered entity to another covered entity for treatment, payment, or healthcare operations does not require a business associate agreement. So much of our presentation today is going to talk about business associate agreements. That's where we're really going with this, thanks to the Omnibus Rule. So just know, this is important, that one CE, one covered entity to another, you don't have to have a business associate agreement in place. So examples of a covered entity would be doctors, clinics, hospitals, nursing homes, other types of providers, dentists, psychologists, optometrists. So those are falling into the provider group. Health plans would be your health insurance companies, HMOs, government programs like Medicare, Medicaid, the military, the Veterans Healthcare Program. Those are all health plans and they're considered covered entities. Clearinghouses. So clearinghouses are entities that process non-standard health information that they receive into a standard format. And so McKesson, maybe a lot of you use a clearinghouse like McKesson. McKesson is considered a clearinghouse. McKesson is considered a covered entity. Basically billing functions are what kind of traverse through the clearinghouses, claims information. So covered entity, I think that we're all pretty good on understanding who our covered entities are. Laboratories, by the way, are covered entities. Quest, LabCorp, those are the ones we see you using most often. So they are covered entities and you do not have to. I've been asked that during an SRA. Do I need a business associate agreement with Quest? And no, you don't. And largely because the definition of business associate per the Omnibus Rule was changed to include that word maintains. So let's look at the next slide. So the new definition of business associate includes that an organization that creates, maintains, receives, or transmits PHI, patient health information, on behalf of a covered entity. So the word maintains is what was added in the Omnibus Rule. And it's meant to give more definition, more understanding of, who your business associates may be. So like a laboratory, like Quest or LabCorp, they actually are covered entity because they're a covered entity and they are liable on their own parts of the HIPAA rule, just like a covered entity is. So business associates then are required, HIPAA requires that a business associate that provides services to a covered entity, which includes access to PHI, must sign a business associate agreement. So who are our business associates? So there's several examples on this slide. And some of these are pretty obvious, easy to understand. Others are new, kind of per the Omnibus Rule. For instance, cloud storage providers. This was addressed in the Omnibus Rule because, you know, when we start using EHRs, that brings about the use of so many more new business associates. And so there were a lot of questions surrounding who do you need agreements with? Who do you need these contracts with to protect? And who's required to comply with the HIPAA standards? So cloud storage providers, that's because they do maintain your PHI. So also e-prescribing services, that was newly added to the Omnibus Rule. They're transmitting, they're receiving PHI on your behalf. A personal health record, that was something that was added per the Omnibus Rule. So as long as the PHR or personal health record is hired by the covered entity, then you do need the business associate agreement in place. Email services. So this is one that a lot of people don't realize, but email services are considered your business associate. Fax service providers and cloud service providers, messaging service providers, texting. So if you're going to use text, then you would need to have a encryption mechanism, and you should have a business associate agreement with that software. So business associates have to have the business associate agreement. A lot has changed about the business associate agreement too. We're going to look more at that. But just to kind of glance over this slide before we move on, let me see if there's a couple of others that your health information exchange. I know that all of you have signed business associate agreements with KHI. They provide a business associate agreement for you to sign. Shredding companies, you may partner with a shredding company as a covered entity, but your business associate, so if you are managed by a third-party administrator, they are your business associate, that third-party administrator. And if that third-party administrator or management company partners with a shredding company for paper and or electronic shredding, then they would have to enter into a business associate agreement as well. And that's what's known as the business associate subcontractor agreement. So let's look at the next slide and talk about these subcontractors for a moment. So a subcontractor is an organization that creates, maintains, receives, or transmits PHI on behalf of the business associate, not the covered entity. So HIPAA requires that business associates enter into a business associate subcontractor agreement with their subcontractors to ensure that subcontractors are also going to appropriately safeguard your PHI. And one of the questions that came about during the formulation of this final omnibus rule is, well, how far downstream can that go? Is there a limit to how many subcontractors that that we get down to before they don't have to comply with HIPAA anymore? And the answer is no. It can continue downstream for multiple levels. And I recently conducted an SRA with a client, and their IT vendor, who was their business associate, was present during the SRA. And he tells me that his company, his IT company, partners with a shredding company to dispose or destruct hard drives on behalf of the covered entity. So I asked him, well, then do you have a business associate agreement with that shredding company? And he said no, that he didn't have to. And I said, actually, you do. You do have to have a subcontractor agreement. It's a thing. And so that was one of the vulnerabilities that we were able to identify, during that SRA. So just because the omnibus rule has been around for a while, we realize that we don't, as covered entities and even as business associates, we really aren't that familiar with the requirements that rule laid out. And that's really why we wanted to share so much of this information today. So one more slide about defining who business associates, covered entities, who they are. We've talked about who they are, but who would not be considered a business associate? So a business associate contract or agreement is not required with persons or organizations whose activities or services do not involve the direct use or disclosure of PHI, and where any access to that PHI would just be incidental. So one that we're all familiar with is our cleaning company. If we have a third-party cleaning service come in after hours, and most of us do, we get asked a lot, should we have a business associate agreement with these people? Because they may see our PHI laying around, or they could get into our cabinets, they could take our laptops, and those are all true things. But remember, when you're determining who your business associates are, one of the important things that we want you to learn from today's session is that you need to go back to the definition of a business associate. Creates, receives, transmits, maintains. Those are the 4 words. If they don't fall into that category, then they're not your business associate. And a cleaning company doesn't do those things. They're not directly involved in the use or disclosure of your PHI. Laboratories are considered covered entities. They're not considered business associates, and they must comply with the HIPAA standards. So you don't have to have a business associate agreement with them. Physician referrals, so when you refer to other physicians, they are covered entities in their own right. No business associate agreement is necessary. Telecommunications service provider, like your phone companies, not required. Workforce members are the people who work for you, your employees. They are not your business associates. Internet service providers, the Omnibus Rule points out, that an internet service provider is not your business associate. It falls under the conduit rule, which I have on this slide as well. So the HIPAA conduit rule says that basically an entity that you are just transmitting, it's like a service that's getting information from one place to another, like a courier. So the US Postal Service is considered exempt from being a business associate because while they are I guess transporting your PHI, they don't have access, and they're not involved in the use or disclosure of that information. Private couriers fall under the same rules. So UPS, FedEx, DHL, Louisville has a small courier service, Beeline. So you don't have to have a business associate agreement with them. And the internet service provider falls under that conduit rule as well. No business associate agreement required with an ISP, internet service provider. Let's go to the next slide. And Seth is going to take us through business associate agreements, and this is where we really get into more of what's changed with regard to business associate agreements with the Omnibus Rule. Because now we have subcontractors, and because now other things have been brought about in the new definitions, then business associate agreements need to be updated since that rule as well. So I'm going to let Seth take you through what the provisions should be of your business associate agreement.
Thanks, Amy. So as Amy's talked about, the privacy and security rule established that you must have a business associate agreement with a business associate. So now that we've established what that is, a couple of things that you really need to look at. Amy touched on the Omnibus Rule of 2013, and you might already have a business associate agreement that you're currently using, and that's great. But we want to make sure that you're looking at several things that are required, or several provisions that OCR says you must have in your agreement. And we're also, making sure that you look at your any expiration dates, or when the last time you edited or updated your business associate agreement. So if you've had a business associate agreement since 2010 and that hasn't been updated at any point between here and there, you might not see things like the subcontractor agreement and stuff like that that are required now because of that Omnibus Rule. So that's just something to look for. But we're going to kind of go into some of the provisions that OCR says you must have. Next slide. Uses and disclosure. So you need to make sure that you're establishing how your business associate is going to use your information and how exactly they are going to be disclosing that information. So you just need to define a very defined line of exactly what they're going to be doing with your information. Next slide. Non-disclosure. So after you set up that exactly what they're going to be using, you need to make sure that they know that they do not need to be disclosing that information in any manner that would either violate any of the privacy and security rules or any of the rules that you've established as what the proper use and disclosure might be for that business associate. Implementing safeguards, as we talked about before, HIPAA privacy and security rule require that all covered entities and business associates must provide the proper safeguards to the information. So you're making sure that there is no unauthorized use or disclosure. You're making sure that you're abiding by all of the HIPAA privacy and security rules, using encryption when you can, using, just any form of protection, and making sure that that is not disclosed. So you're making sure that your business associates are taking that just as seriously as you are as a covered entity. Breach reporting is very critical because, we've talked to a couple of places and, they've said that there was a breach and we weren't really told about it by a business associate. And so then we started asking questions, do you require that in, your business associate agreement? And they're like, no, we didn't know we should say anything about that. So you want to make sure that you're requiring your business associates to disclose any information to you that could have been a breach, or including any incidents that might have happened. Also, you want to establish the access level to your PHI. So we go into a lot of organizations, and again, we ask a lot of questions pertaining to business associates. And one of those questions is, what access level do they have to your system as far as PHI is concerned? And sometimes they have no clue. And sometimes they are like, well, they just said they needed access, and so we gave them admin rights. You need to make sure that you establish what access they have and why that information, why you give that level of information. And again, you need to establish that, the privacy rule is important to you as a business associate or as a covered entity, and you need to make sure that any privacy and security rules are abided by your business associate. Next slide. Also, disclosure tracking. So you need to make sure that your business associate is taking all records, making sure that they are keeping records, keeping books, and any records relating to any disclosure of PHI. So going back to your use and disclosure, how are they using it? And then you need to make sure that they are tracking all of those situations where they're disclosed and how that's being created or received by the business associate. Termination of contract. So this is a big one that a lot of people kind of forget, that if there's a termination of a contract, you need to make sure that your business associates are returning or destroying and providing proof of that destruction of any health information that they have created or received from you as a covered entity. So like I said, we have a lot of people that are not confused by this, but they just think that, well, I have an agreement with them, so it's just going to be infinite. Well, if that termination of contract or agreement comes up, what happens to that information, and making sure that it just doesn't go into the abyss and end up somewhere it shouldn't be. As Amy talked about before, the subcontractor agreement was really brought in by the Omnibus Rule. And you need to ensure that all of your business associates, if they're using some sort of subcontractor or third party, that they are getting a subcontractor agreement for protecting your PHI, because that information is just as pertinent to your business associate as it is you. And so you just need to make sure that they are safeguarding that with an agreement. And then violation of contract. So if those contracts are violated, if the covered entity decides, that contract of establishing use and all the information that's covered, it has been violated in any way, this is just a violation of the contract. And I'm going to turn it back over to Amy to talk about some breaches. This is the fun stuff.
Well, it wouldn't be a HIPAA presentation if we didn't talk about breaches, right? So Seth, thanks for telling us, and taking us through what the provisions are for a business associate agreement. And let me remind you that those provisions, many of those were added again as part of the Omnibus Rule, like the breach notification, the subcontractor agreement set provision. So you do need to make sure that your business associate agreement that you're using has been updated to reflect the changes of the Omnibus Rule. I am going to talk about breaches. I'm going to tell you that there's, the 9 most common causes of breaches, one of which is a business associate disclosure. So there's been a disclosure or a breach at the business associate level. Well, so let me just tell you what the other ones are, but we're going to focus on business associates, as you probably could have guessed. So professional hacker attacks definitely are making up the largest category of breaches, with more than 50% of attacks last year, 2019, reported were due to professional hackers. Business associate disclosures made up over 23% of breaches last year. Can you believe that? I mean, that's crazy, which is another reason that we definitely wanted to get this on our agenda for this year. But others include insufficient IT security measures, lost or stolen devices that are not encrypted, unauthorized access to PHI, so we don't, maybe we're not deactivating accounts quickly enough. That's just one way that could lead to unauthorized access. Accidental disclosures by employees, incorrect admin procedures, employee dishonesty, and improper disposal of data. But what we want to do is circle back around to this business associate disclosure and the fact that this can lead to breaches. And I want to talk about that business associate agreement just a little bit more. I've read some breaches, not breaches that I'm going to highlight today on my slides, but there was one that really significantly stood out to me recently that was from last year. It was a breach last year. And when OCR came in and investigated, they found that the business associate agreement was in place, but had not been updated. It was last dated 2005. So what does an auditor from OCR, what does that tell them? Well, it tells them that they aren't familiar with the Omnibus Rule. It tells them that they don't have an updated agreement in place. And that actually was cited in the resolution agreement, which I'll tell you more about resolution agreements as we go through these more breach information. So let's hop over to the next slide. If a breach does occur by a business associate, then now what is a business associate required to do? So, the Omnibus Rule really strengthens up those requirements for business associates and says now that the breach notification rules apply to business associates as well as covered entities. So the business associate is required to notify you, the covered entity, that a breach has occurred. They have to do this within 60 days of discovery. And they are required to identify each individual affected by the breach to the best of their ability. Your business associate agreement, you know, the breach notification provision should really define all of this information and the guidelines for which they are required to notify you. And that's one of the things an auditor is going to be looking for, is that provision on your business associate. And let me say this, between the covered entity and the business associate, sometimes it may be appropriate or more appropriate for the business associate to notify OCR of the breach. And other times the covered entity may choose to notify OCR of the breach. And it really depends on the organization and the nature of the breach. And I'll tell you, I'm going to give you an example of that. Let's go to the next slide. Before we get into some examples, I want to tell you that when you break it down, this omnibus rule, it now says that business associates are directly liable for HIPAA violations as follows. So it's really the failure to do these things that constitutes the violation. So failure to provide HHS with records and compliance reports. And actually that's a provision in your agreement that they would do that if they are asked to do so by HHS. They also, if they take retaliatory action against any individual for notifying either the covered entity or OCR of a HIPAA complaint, if they take a retaliatory action, they're liable for that. That could lead to a violation. They're liable for failing to comply with all the requirements of the security rule that pertains to business associates. So for instance, they are required to have an SRA, as Seth laid out at the beginning of this presentation. Security risk assessments are required by covered entities and by business associates. If they don't have a security risk assessment and that is identified during an audit, well, that can lead to violation for the business associate. Failure to provide breach notifications to the covered entity or another business associate if necessary. Impermissible uses and disclosures of PHI, protected health information. They're liable for that. They are liable for failing to disclose a copy of ePHI to either a covered entity, the individual, or the designee, whomever is requesting. And that is a provision in your agreement as well, that business associates will provide copies of ePHI upon request. So if they don't do that, they can be held liable for that. By the way, did you know that part of the HIPAA Omnibus Rule and new CLIA requirements since Omnibus says that labs, so LabCorp and Quest, your patients can directly request copies of their PHI from LabCorp and Quest. And LabCorp and Quest are required to provide them with copies of their PHI. So they are required to do that. But again, LabCorp and Quest are not your business associates, they're covered entities, but just wanted to throw that in. Reasonable efforts to limit PHI to a minimum. Business associates and covered entities are all applicable to the minimum necessary rule. Minimum necessary means I'm going to give you the minimum necessary access to my PHI to allow you to do your job. Nothing more. So your business associates are liable for making sure that they limit their PHI to the minimum. And then providing an accounting of disclosures. If HHS asks for an accounting disclosures, then your business associate must be prepared to provide that. Failure to do so could lead to violation. Failure to enter into business, here we go. If they don't enter into business associate agreements with subcontractors that create or receive or maintain or store PHI on their behalf, big violation. And trust me, when I say big, it can be big because of the breach notifications and the breach resolution agreements that I've read. There have already been making examples out of some business associates for this. And then reasonable steps to address a material breach or violation of the subcontractor's business associate agreement. So a failure to address that breach within time, being timely on it, providing information on behalf of the subcontractor or working with the subcontractor to assist them through can lead to violations. Okay, what do we have on the next slide? Oh, well, penalties. Okay, so this is the scary part, right? So how much money am I going to have to pay? Well, you know, this slide shows the cost of HIPAA violations when it comes to civil penalties assessed by OCR or HHS. But let me just make it a little bit scarier for you, because civil penalties, it doesn't just stop at civil penalties. There can be criminal penalties assessed. There can be state's attorneys general penalties assessed, and you could also be subject to a class action lawsuit filed by patients. So it's not just the penalties that are assessed by HIPAA or by HHS, but there can be so much more fallout when it comes to penalties. And as we've talked in our roadshows in the past couple of years, a corrective action plan that comes along from OCR can cost a lot of money too. One of the reports, we're going to talk about this big major breach that LabCorp and Quest had last year, but one of the reports that I read said, you know, we did see that $16 million was assessed to one of those entities, but by OCR for civil penalties. But another report that I read said that in the end, that breach could likely cost LabCorp and or Quest up to $1 billion when all is said and done, between all of the harm, the punitive damages, harm to the company, switching vendors, you know, that sort of thing. So yeah, it can go beyond the OCR penalties. But in April of 2019, so this was well after the Omnibus Rule, HHS changed the penalty structure of the civil money penalties. And there's 4 tiers. And these, I can't really see the words very well on my slide there, but I'll tell you that the tier 1 is, I guess you could say, the least damaging, if you will. If tier 1 penalty says an entity didn't know about the data breach, and if you broke HIPAA rules unintentionally and you can prove that you were unaware of the violation, the civil penalty for unknowingly violating the law is anywhere from a minimum of 100 up to 50,000 per violation, with a maximum annual limit of $25,000. Tier 2, an entity knew about the violation but had a reasonable cause to neglect HIPAA rules. In this case, the penalty is a minimum of $1,000 per violation and up to $50,000, with a maximum annual limit on of $100,000. And tier 3, so this is where we don't want to be. An entity willfully neglected the violation but corrected it within 30 days after its discovery. In this case, the penalty is $10,000 to $50,000 per violation, with a maximum annual limit of $250,000. Tier 4 is the worst case scenario. You knew about the violation, you willfully neglected it, and you didn't fix it in time. It's punishable with a penalty of $50,000 per incident, and the maximum annual limit for a tier 4 violation is $1.5 million. This is what I want to tell you. That what you need to know is a violation, there's calculating methodologies that go into this, and they're complex, and I'm not an expert on it. But in a nutshell, a violation, when we talk about breaches and there's 3,000 records that were breached, that's 3,000 violations. Then they can go into how many days did it take for you to correct it. So if that went on for 120 days, that's 3,000 records times 120 days. That can be your number of violations. So when you're talking about the cost per violation, you guys, this can add up enormously. So when you see those maximum costs per year, that's just per violation. And then, so when you see news reports and releases coming across that an entity had to pay $5 million or an entity had to pay $2.5 million, that 1.5 million cap per year does not mean overall across the board of all your violations. All right, you can be assessed per violation, and in each category of violation there can be that maximum cost, but the amount of your violations in all the different categories can add up. So you know, a covered entity can be assessed more than a $1.5 million penalty as a result of a major breach. Okay, so let's go over to the factors in determining penalties. So again, I told you, there's a calculating methodology and it's complex, and you know, you don't have to be an expert on that. You just need to know that it can be serious. But you know, what else does OCR factor in when they're determining violations and penalties? Some of it I've already kind of told you. The length of time the violation, how long did it go on? Some of the breaches that I read were allowed to go on for months. The number of patients or people affected, so 50,000, 2,000. So, you know, that's all taken into consideration when determining penalties. The nature of the data exposed, what types of information was exposed, your willingness to assist in OCR investigation. And not only your willingness, but if the breach happens at the business associate level, their willingness to assist OCR in the investigation. So I just want to give you some advice. Be willing to assist in the investigation. It will help you. It will not hurt you. And then a prior history of compliance. So yes, they do take into consideration repeat offenders. You know, have you had this breach occur or something like this happen before? And now here we are doing it again. Well, that matters. But have you had a pretty clean record? They're going to take that into consideration. So stay compliant with your HIPAA requirements. It will work in your favor. Have your SRAs completed, have your business associate agreements in place, and all the other things. Your financial condition. Okay. This is something that I do want to elaborate on a little bit. What's meant by your financial condition? Let me read to you a little bit of what I found in the actual final rule. So an entity's financial condition can affect a civil money penalty in either direction. Okay, that is, while an entity in poor financial condition may face a lesser penalty if its financial condition affected its ability to comply. An entity so if it affected your ability to comply with HIPAA standards, and that your poor financial condition kept you from being able to meet all of the safeguards, then that would be taken into consideration. But on the flip side, an entity with greater financial resources could be subject to higher penalties for violations, in part because it had the resources to maintain compliance. So that's what's meant by financial condition. It doesn't mean if you're in the process of going bankrupt and you have a breach, they're automatically going to indemnify you of penalties. They're going to apply it to your ability to fund the resources needed to comply. That's how you look at that. And then the overall amount of harm caused by the violation. And that's very objective on OCR's part to how they figure that out. But these are the factors that they take into consideration. And this isn't everything that they consider, but these are the ones that are mentioned in the final rule. So this is what we know. And when they share information with us, you know, we definitely want to know it, understand it, and apply it throughout our organization. So are we going to get to the fun part? Yeah. Now let's get to, no, I shouldn't say fun part, but this is, you know, this is the part where it's just amazing when we read about breaches and how they occur and how many records are involved and what happens. So I know that all of you had to at least read a little bit or hear a little bit about the breach last year in all of the headlines, you saw LabCorp and Quest. But did you know that actually it was a business associate breach? The business associate was the American Medical Collection Agency. So it's a collections agency that was performing services for LabCorp, Quest, and several other covered entities on their behalf. And basically it was a cyber attack that compromised the payment system, AMCA's payment system. An unknown party gained access to the AMCA website and executed an attack on their payment pages. And attackers, what they did was they logged the information, and the information they were logging was payment information and personal demographic information that was entered by visitors. And this went on from August of 2018 until it was discovered in May of 2019. So the number of records, the number of customers, 7.7 million on LabCorp's side and over 12 million on Quest side. But here's the good news for Quest and LabCorp anyway. They did have a business associate agreement in place with AMCA. AMCA, as their business associate, is required to follow all HIPAA standards. We know that. So what I expect, I haven't seen any releases yet about any penalties, I mean, there have been lawsuits and AMCA has filed for bankruptcy, but as far as penalties coming out, that hasn't happened just yet. What I expect, now I'm not the expert here, but what I expect, and based on other breaches that I've read, is that I don't believe LabCorp and Quest will be penalized. But I do believe HHS will levy fines and penalties against AMCA because this was the second largest healthcare breach in the history of healthcare, behind the Anthem healthcare breach of 2015. And just so happens it's a business associate breach. Okay, let's go to the next one. Just a few other breaches that actually happened at the business associate level last year. There was Centerstone Insurance and Financial Services out of Texas. There were over 111,000 patients affected. This was a phishing attack. So email is how it got in. And we don't know, based on what I've read, I don't know if there was a business associate agreement present. I actually don't know if there was a business associate agreement present with any of these three. I'm still kind of investigating and reading about these myself, but I wanted to just share with you guys that let me make sure you guys can still hear me. Okay, 6 minutes left. I talk too much, you guys. So, but these are business associate breaches that did occur last year. You can look these up, you can Google them. It'll be interesting to follow to see what the outcome of these breaches are. Next slide, Brent. Okay, so resolution agreement. What's a resolution agreement? You know, I read these all the time and I always tell you guys about resolution. What it is it's an agreement between OCR and a covered entity that comes as a result of a breach. It's been determined there's a breach. It gives the history of the breach. It supplies a corrective action plan that the entity, the covered entity or the business associate must follow to become in compliance. And it also will highlight or you know, it has the penalties that are assessed. So what I have on this slide is specific to every resolution agreement that I have read about business associates has this section that pertains to your business associate agreement. So I wanted to share it with you because what this basically can do for you is tell you this is what OCR is getting on to these business associate or these covered entities or business associates for not doing. This is what they're supposed to be doing. So we're going to take that out of this resolution agreement, share it with you so that you know right here in black and white, if you have a breach and you know, you end up being a part of a resolution agreement, you can expect to see this very same terminology in your corrective action plan with regard to your business associate agreements. I also want to tell you that, we didn't see a lot of this prior to the Omnibus Rule, but what's happened since the Omnibus Rule is that OCR says we're serious about getting your business associates in order, knowing them and having agreements. You have to have an agreement with every single one. So they want you to designate an individual or individuals responsible for maintaining your business associate agreements. They want that person to be able to assess future and current relationships to figure out, is this a business associate? By definition, they expect you to enter into a business associate agreement with every single business associate. They expect you to have a standard template business associate agreement. And again, it needs to be brought up to date if it hasn't since the Omnibus Rule. You have to maintain documentation of your business associate agreements, even if they terminate for at least 6 years after termination. You have to delimit the disclosures of PHI to the minimum necessary. You have to provide the policies and procedures identified with regard to your business associates for HHS to review and approve. You have to provide an accounting or a list of all your business associates that include the names, the description of service, and the dates of the contracts. And guess what? Now they're saying you have to provide us with a copy of all your business associate agreements. So if you want to know what our OCR is going to ask you for with regard to business associate, this is it. All right, I'm going to turn it over to Seth to wrap us up on, now that we know all of this, how are we going to track it?
Thanks, Amy. Yeah, like Amy said, a lot of this, we need to see what exactly we need to be tracking as far as business associates. And Amy touched on a couple of these, but we'll still go through them. So you need to have someone that's managing all of your business associate agreements. So not just one specific department, but you need to have assigned to a specific person to have and take care of and manage and oversee all of those business associate agreements. You need to make sure that you have a list of all of your business associates. So if OCR comes in because of a breach or just an audit or anything, they're going to ask to see a list. And then not only are they going to ask to see a list, but as Amy said, they're going to ask to see a copy of your business associate agreement. So you need to make sure that you're keeping all that information. That person that you have assigned to oversee that is tracking that information. And as we talked about early on, you need to make sure you know what access level they have to your PHI, because that's critical in knowing what aspects they have access to. And then you need to make sure that your business associate agreement has been updated. As stated earlier, if you've had a business associate agreement that was signed or even created before 2013, it might be out of date with some of the aspects of the Omnibus Rule that published in 2013. So you just need to make sure that you have an updated list and that, that has all the aspects that we talked about earlier. And then you need to, talk about with your business associates, and if they're conducting a security risk assessment of their own, because you as a covered entity you pride yourself on making sure that you're abiding by the privacy and security rules, and you need to ensure that your business associates are also doing that. So you need to make sure that they are conducting a security risk assessment of their own. Next slide. So, and this is just a quick, with COVID-19 going on, and I don't know if you said in on the previous telehealth, but as we've stated before, there are some provisions that have been, sanctions and provisions that have kind of been waived for covered entities and business associates. We're not going to go into too much depth of that, but I just wanted to make sure to give a little, feel free to go to the hhs.gov website. Because they have a lot of critical information in there, and you still want to make sure that just because they have these temporary sanctions in place, that you're still abiding by all of the HIPAA privacy and security rules to the best of your ability.
Seth, can I add something just quickly here?
Yeah, of course.
Since we are talking about telehealth and we're talking about business associates, we know that we're seeing patients more on these platforms. I want to tell you a little bit. Zoom, if you're using Zoom with your patients, you need to be using the healthcare platform that Zoom provides, because it is HIPAA compliant and they will provide you with a business associate agreement. And then FaceTime, Apple is not going to sign a business associate agreement with anyone. They've made that very clear. But this waiving the sanctions and penalties, it's okay to use FaceTime with your patients for the time being that we are still declared under a national public health emergency. But FaceTime will not be acceptable once this public health emergency has been declared ended. So keep that in mind. Once we are not under this state of emergency, if you're going to resume and continue with telehealth, you will need to partner with platforms that will sign business associate agreements with you and that are considered HIPAA compliant. So reach out to us anytime if you want some more information about that.
Perfect. Thank you, Amy. That's a very good point. So this is just talking about, we've covered a lot of information here today, and some of you might be overwhelmed, but we do offer some services. We talked a lot about security risk assessments, and that is an item that we do provide. And, feel free to contact us. Right now, we're actually offering a virtual security risk assessment because, again, we're in a pandemic right now, and clients or patient safety and facility safety is critical. So we are offering that service for now. We also have a vulnerability scanning assessment and assessment service line that we have recently implemented. Just taking a security risk assessment a step further and looking into your networks and devices just to see what things might be vulnerable to your systems. And then, if you are having, again, if you're overwhelmed with some of this, we have a vulnerability remediation service line that we can help you develop some of your policies and procedures and take a look at your business associate agreement. And, of those identified items that are potentially vulnerabilities, we can help you create a remediation plan from that. And then we also have HIPAA security and awareness education and training. And this is just if you would like to reach out to us. I think we're going to show another slide if you haven't already seen our website and everything, but we've got some coronavirus updates. We've got a HIPAA section on there, so feel free to look at that, or like I said, the hhs.gov site. And the next slide.
Thank you, Seth and Amy. We're out of time for any questions, so please send them to us at kyrec@uky.edu, and we will get them to Seth and Amy so that they can answer them for you. And this whole session of the business associates and our previous telehealth are really timely because we really need this information to keep our PHI safe and be able to still provide services to people within the national emergency. And we're here to help you sort all of that out. Don't forget, if you haven't signed up for a specific day and you see something you want to attend, our registration will stay open all week. And if you have any questions about the week of webinars or about the services and our specific webinars, contact us at kyrec@uky.edu. Thanks so much, and see you tomorrow.